Life, the health show, brought to you by Cosmo Medical, Guwahati.
A very good afternoon, viewers. Welcome to Good Life, the health show. I am Reshma, and this show is all about bringing you practical solutions to your health concerns, lifestyle related issues, and much more to help you lead a healthier, better life. Today, we are talking about emergency and intensive care. And joining us today is Dr. Hrishikesh Hazarika, CMD of Cosmo Medical and Senior Consultant Intensivist. And welcome to the show, Doctor. It's a privilege to have you here.
Yeah.
Well, Dr. Hazarika specializes in treating critically ill patients who need immediate attention and round-the-clock care. And we will also talk about how timely emergency response, advanced ICU care and strong infection control at Cosmo Medical help improve patients' outcomes. And without further ado, let's quickly come to the questionnaires. Doctor, as a senior intensivist, what kind of critical cases do you mostly have to handle in your day-to-day life?
Yeah, first of all, thank you Notice Life for welcoming me on this show. In day-to-day life, we tackle so many emergencies. So, first of all, the priority goes to road traffic accident. We get a lot of cases of trauma cases where young lives were lost. Secondly, we get stroke patients. Third, heart patients, heart attack, heart failure like those. And fourth is lung infections. So, these type of cases we commonly encounter in our day-to-day life. Mostly these accidents are very fatal. Sometimes most serious accident with head injury, spine injury. These young kids driving bike, having accident comes to our emergency, and it's a very tough challenge to save their lives.
Yes.
Like this, all kinds of cases we deal. Yeah.
So, doctor, like you mentioned about the stroke, the health issues, these cases are rapidly rising. So, you as an intensivist, specialist in this sector, what do you want to give a message to people, how to recognize if you're going through stroke and what to do at the last stage?
Yeah, stroke patients, it's alarmingly rising nowadays. Mostly stroke is a disease of the elderly, mostly 60 plus. But nowadays we are seeing young patients having stroke. So, I think the most common reason is hypertension, the blood pressure, rise in blood pressure. People often ignore high pressure, but it becomes fatal when they have got a stroke. So, and another things like lifestyle, sedentary lifestyles and these food habits, smoking, alcohol, all contributes to stroke. But the major thing is lack of exercise and hypertension. Your blood pressure, you should have control over your blood pressure to minimize the risk of stroke. So, people, we met many people, though they took Ayurvedic, they think of something, exercise. But if your blood pressure is more than 150/90, we strongly prescribe to take a medicine and seek a doctor and take his advice. And continuously you have to monitor your blood pressure. So, if your blood pressure is under control, stroke, I think we can prevent it.
Yes, doctor, also what are the early signs of stroke or heart related issues?
Stroke as early sign I can tell you because it's a sudden attack.
Yes.
But early strokes mostly there are two types of stroke. One is where blood gets blocked, and when another is when blood gets burst. So, ischemic and hemorrhagic. So, ischemic, there is a golden period around 4.5 hours. So, first there will be a weakness in one side of body, he or she will be unable to talk, and she will feel that one side of the body is paralyzed. So, that is ischemic stroke, and if we get ischemic stroke within 4.5 hours, then results are very good. But due to many reasons, people don't rush to the hospital immediately. They took some alternative measures, and when golden time is out, then they go and gets admitted in hospital, because we can thrombolize the stroke if we get in within 4.5 hours. And second stroke is hemorrhagic, where blood comes out. It's mostly sudden, whenever you are, it's in the early morning, mostly in early morning, but during any time of the day it can occur. So, blood comes out, and it's a very dangerous thing. If you don't get treatment within 2-3 hours, the things will get very fatal, and saving the life is very serious. So
Also, doctor, talking about the emergencies, the stroke, be it the heart related issues, and given the fact now it's the end of the year and there would be more cases, it should not happen, but there might be more cases of road accidents. How does Cosmo Medical look forward to serve for the emergencies?
yeah, we are very swift in our approach to the trauma patient. Whenever one patient comes, our emergency team is always ready. We give a quick check, outer survey, what major injuries are there. So any bleeding point, anything fracture, anything, we try to stabilize at the most early. Then we go for CT scan, and second, whatever these major procedures are needed, that are done accordingly. But first priority is to save the life. So any bleeding, any issue that is more dangerous, we prioritize that. We take care of that organ first, and we immediately shift to our ICU, and after CT scan reports come, if any major thing or any operation needed, we do it immediately.
Also, doctor, what are the key facilities and also advanced services provided at Cosmo Medical that sets it apart in cases of the ICU sector or the emergency? What are the key facilities?
Yeah, we are a well-equipped hospital. I will not say that we are better than others. So all the advanced techniques or whatever instruments are there, it's available in Cosmo Medical, and we are doing laparoscopic surgeries, head injury or neurological operations, orthopedic operations, gynae operations. Everything is there. We are following the new trend, or CT scan or EEG or X-ray. All new technologies are there.
Also, doctor, when it comes to about being hospitalized or be the checkups, a lot of tension is set upon the people, the patients, or the guardians coming in with the patients. What do you have to say on that part? How it is easy for people to come up to Cosmo Medical and set their patients there?
Thing is that people don't enjoy coming to hospital.
Obviously.
So going to a hospital is first you have to correct your mindset, you have to get prepared, then only they visit a doctor. So most of the time things gets late because of this mentality, and diseases are like that. If we get it early, we can diagnose early, we can treat also easily. But once, because the whole body is system involvement, if disease is in one system, if we get to do it late, it will involve another system. So things get complicated. So at Cosmo Medical, if someone comes, we are doing everything, all tests, and whatever possible remedies we can give, whatever treatment we can give, we are giving, and trying our best to satisfy people.
Also, health insurance is a major concern for a lot of people. So could you explain how insurances are being looked upon, and also about the care, about the expenditures, reimbursements?
Yeah, nowadays it's a truth that health is expensive. Health has a cost. So these insurance are a bless at time of emergencies, but still now in Assam specifically, not all people are doing. Most of the population is in rural, and insurance, I think, is still lagging behind getting covered all the population. But in Cosmo Medical, we have insurance facilities. People who don't have tie-up can get reimbursement also, and we are doing cashless facilities also. So they don't have to pay, they have to just come and take the advantage of the insurance thing. That's
Also, doctor, infections in hospitals are often a fear among patients. What strict infection control measures are followed in your ICU to ensure patients' safety?
See, infection is everywhere. Infection is everywhere. Once your immunity is down, infection gets you, and they will cause disease. So most in ICU, I think most of the hospital are practicing. In ICU, the patients are sick, so they are already immunocompromised. They don't have the ability to fight infections. So if infection, you don't control the infection in ICU, your patients will get worse. So every possible measures are taken to control the infection, and I think most important thing is hand washing. So after there are steps of hand washing. So, we practice it in our day to day life, so that no contamination goes from us to the patients, and other bed making, floor cleaning, that all whatever guidelines are there, we are following it. And till now, by God's grace, we do not have such severe bugs, bacteria in our ICU till now. We are almost completing 2 years, but still the bacteria that is growing in our ICU, they are less virulent, less bactericidal. So, I think because I have worked in many ICUs, so these resistant bacteria, they are not in our ICU till now by God's grace.
Also, let me tell our viewers that we have the Cosmo Medical's number flashing on the lower band of our episode. You can check it there. Also now, doctor, there is a common allegation that hospitals sometimes keep patients admitted longer only for financial gain. As a doctor, how would you respond to this concern? How do you decide when a patient is fit for discharge?
Yeah, that's a common allegation we face day to day, but I think no doctor will accept it. Every doctor will deny it. I don't know about the corporates, but whoever doctor is there, no doctor wants the patient, no doctor wants to keep the patient, or no doctor wants to harm the patient. So, we explain everything to the attendants, to the patient attendant, whoever is there. We have to explain the whole situation, and if death is inevitable. So, if a patient condition is bad, we explain the whole situation, that this and this you need, or that and that, and it is the patient attendant's decision whether to keep him, to continue the treatment although there is no hope, to keep and try fighting the disease. So, that is completely the family decision. We from my side, I explain everything in detail to the patient attendant, that the patient condition is this and this, and if we keep good touch with attendants, so actually they also try to believe us, and they believe us, then there is no misunderstanding.
So, there has to be a little understanding from the other side as well, because the effort is to help the
both
patient.
Side,
Yes. Also, doctor, there is another concern we often hear is about ICU behavior. Some people allege that nurses or staff can be harsh with patients or attendants. What is your response on this, and how do you react on that?
Sometimes these cases we see daily in our Facebook or Instagram, this kind of violence is happening. But the thing is that I can't assure you that who is correct or who is wrong. But sometimes hospital authority is correct, sometimes attendants are correct. So, it is a mixed situation, but I think if transparency is there, you take patient attendants in your faith, and they also believe you, and the communication is two-sided, and everyday communication is most important. So, if everything is transparent, I think still these situations can be avoided.
Also, before we take a short commercial break, we will ask you this one question. For families, emergency situations are emotionally and financially stressful. How important is, like you mentioned, how important is transparent communication between doctors, hospital staff and patient families? So, on your side, how are the nurses being very kind towards the patients?
Yeah, nursing is a divine job. They do all the hard work. They are the backbone of any hospital, because doctors, they advise and follow up, and this whole care system is given by nurses only. And I also understand that the family or the individual whose relative is in the bed, ICU bed, they go so much emotional turmoil, because they have to, because someone's father is there, someone's daughter is there, someone's son is there. So, it is a bit emotional thing, and plus finance also they have to see. Because all people talking something at their back, this whatever. So, these patients or these attendants, they go a emotional turmoil. We as a doctors, we understand the feeling, because we are also human beings, and moreover at that point situation sometimes gets worse, but I think the hospital authority or the nurses or the hospital, those who are working in the hospital should be compassionate. We try to be compassionate, we try to understand their feelings, we try to handle them more softly, and we try to avoid those situations, but this is unavoidable. Sometimes things go worse, but every time we at Cosmo Medical, we try to avoid these situations. We listen to them, because listening solves many problems, I believe.
Exactly, listening solves many problems. We'll have more questions for Dr. Hrishikesh Hazarika on this topic, but we'll take a very short commercial break. Don't go anywhere. Keep watching Good Life, the Health Show. Welcome back, viewers. You're watching Good Life, the Health Show. We are having a conversation with the CMD of Cosmo Medical and the consultant senior intensivist, Dr. Hrishikesh Hazarika, in the studios at Notice Live. Well, doctor, on a personal note, what inspired you to become a doctor and later specialize as an intensivist? We'd really want to hear on that part.
Yeah. So I'm a first generation doctor. No one in my family is a doctor. So basically, I was a bright student. So my parents, they always told me to become a doctor, to serve the humanity. So from a small age, that has set up in mind to become a doctor. So that's why I became a doctor, because to initially to fulfill my parents' wish. In MBBS we are studying, we are enjoying life. So I didn't have that insight of a doctor. So after completing my studies, when I get into practice, that time I felt, what is a doctor? Because you have to deal with everything, and patients. Some patients are conscious, or some are, they talk to us at night whenever we go. So they tell their history. So it's a patient-doctor relation. So that time, sometimes we feel that we have to save this patient, because his marriage, the son marriage is after 2 months. So because people sometimes, young patients around 50, they have so many desires. Suddenly heart attack come up and he was landing in ICU. So he was not prepared for it. So like those it means conversation over in ICU. So it felt good. Whenever we save a patient, it felt good, because that time we are not on the monetary side. We are on a fixed salary. So whatever was there, that was only pure feelings. So at that time, I understand that this is a noble profession. Being a doctor is a special thing, because you are getting chance to treat, and sometimes people call us God. I don't. I feel shameful when someone calls me God, but that sentiment to call someone God, and sometimes people touch our feet also. So these are situations, but I respect the feeling of that person. So these blessings they have give, and there are few professions, I think, where you get the blessings. So doctor is one profession where you get money, but you get blessings also. So that's a very noble thing. So like that, and I was in Delhi for around 8 years. Then I came to Guwahati again, because my hometown is Guwahati. So I was working in different hospitals. Suddenly I felt that why should I work in another hospital or other hospital? We should make our own hospital, so that we can serve the people at my choice. So now with that dream, we have started our journey, and we established Cosmo Medical. Now we are treating patients. So any poor patient, we can now treat him at a lower price, because I don't have to ask other person. So things are now flexible, and I think I am now better able to serve the humanity, serve the poor people, serve the people of Assam. So this is my sentiments. So I am now satisfied to have my own establishment, and I am serving mankind through my own way.
So doctor, like you mentioned that you wanted to help the poor people, can you tell our viewers, through Cosmo Medical Services, how can the people who are economically weaker, how do they can afford for Cosmo Medical?
Yeah, our motto is from the first very beginning, we are concentrated on affordable healthcare. So till now, I think whatever is set up is we are doing the operations at a very flexible rate compared to other hospitals in Guwahati, and our ICU packages are also less. Overall, compared to other hospitals, we are keeping our prices down, and moreover we are accepting this BPL and ration card. Those people who are economically poor, we are doing giving discounts upon those cards, and we are helping people. Mostly our patients are from economically poor society. We don't have the high class, so middle class and lower class we are serving. So whatever we are adjusting, because we don't like that we have to give this much on this much. There we are discussing, people come problem hai, to theek hai, okay, we are, so that he is also satisfied, we are also satisfied, and we are helping these poor people, because some long term accident cases they come for 1 month, the recovery takes 1 month. So we fix a budget that you have to give this much only, how much time he remains, that is our responsibility. Like that we are changing our everything, but according to this attendant or the families, we are changing our these styles, and we are giving maximum discount, so that every poor can come to us and take the treatment, take the health facility.
That's quite a very noble cause initiated by the Cosmo Medical. Also, doctor, can you quickly share some of your good part of your life where you have witnessed a life-changing moment while treating a patient? Anything from your educational days or till far?
There are many actually. So there are many cases, because the most satisfying moment is when a young life we can save. So most of the accident patients, head injury patients, when they get back on their feet and walk out of Cosmo Medical, we feel very very enjoyable moment, and this their families thanks us, and we have our Instagram page also, many feedbacks are there. So and most some patients, they come very in a very serious condition, they are referred from periphery hospitals. So and like other things, the pregnant ladies, because if we can save them, it's a bless. So this kind of, there are many stories.
If you could share one, if it's possible.
So last month we have discharged one patient, head injury patient. He's the only son. So his father and mother were very tense, and he was in hospitals I think 22 days. So at the time of discharge, he was going to bathroom, eating, everything he is doing. So they were very satisfied. He was very serious. He was in ICU for 10 days, I think, like that. But by grace of God, he was discharged in a very fit condition. So they will come for checkup. Like that, many cases are there.
Also, doctor, at a personal level, what basic habits or precautions would you advise to people to follow in their daily lives to prevent from infections or any diseases and stay healthy in their life?
Yeah, nowadays people are becoming more conscious about health. So you can see lots of gyms are coming up. So basically what I think, exercise is mandatory.
Yes.
What form of exercise? You go to a gym, or you do walking, or you do yoga, or any other kind of, but that's a mandatory thing. And second is food, because nowadays you also know food is impure everywhere. So whatever you can have some good food. Don't go for this fast food and all refined foods. And third is have a basic health checkup. So it's a very important thing to get your body checkup in every 6 months or at least in a year, because a health checkup will cost you around 10,000, but losing a life is very I think very pricey thing. So don't think that 10,000 rupees is very much, but this health checkup, yeah, I think in metros they are doing health checkup. Nowadays corporates are also doing health checkup of their employees, but those who are not in this loop, but they are at home, but they are not getting those kind of facility, but they should themselves get a health checkup every year. It's a must, because nowadays disease has changed.
Yes.
You may look fine, you may look healthy from outside, but inside what is happening, your blood reports or your ultrasound, that will show you. So, my urge is doing all those exercise, preventing this food and everything. Okay, these are all okay, but health checkup is must. So, every year one health checkup is compulsory above 40 years.
Yes, doctor, absolutely well said. Doctor, you being the CMD of the Cosmo Medical, what is your vision in future? How do you look forward to take it?
Yeah, well, we are a small institution. We have just started. We are about to complete 2 years. Till now, we have, I think, treated 2000 patients in these 2 years, mostly IPD patients, not OPD. IPD 2000 we have crossed. So, our vision is to do more to the society, do help the poor people, and those patients who are not who have financially down to get the best treatment, they can come to us. We will do it, we will try to do it in a very manageable way, and hopefully we get more blessings from Assam people, and we can go towards our dream. And I think New Year is coming up. Next year we may become more successful towards achieving our dreams, and if by God's grace we can develop more, we can open another one, that will be a bliss.
Well said, doctor. Thank you so much for joining for Notice Live and speaking for Good Life, the health show, for your quality time. Thank you, doctor, for joining us. And viewers, with that we come to the end of today's show. We hope this discussion helped clear your doubts and gave you useful information. We'll be back soon with another episode on important health topics. Till then, take care of yourself, stay healthy, stay fit, and keep watching Notice Live and Good Life, the health show.